So we know that with the start of the school year, kids are in close contact with each other again, and there's exposure to germs. So the common cold is a major contributing factor to the September peak in terms of asthma symptoms being exacerbated and asthma attacks happening more frequently. One of the other factors that contributes to this is the fact that during certain times of the year, especially during the summer, children, families are out of routines. They may not be using their asthma medication properly, especially if they're feeling well. So it's important for parents and educators to understand that asthma medication, controller medication, which is the daily medication that people are most often prescribed to manage asthma symptoms, needs to be taken regularly and daily as prescribed. If it doesn't, then it can lead to a situation where those types of factors, such as exposure to the common cold and other viral factors that kids are exposed to at school and other triggers and so forth, it just can contribute to it having a larger effect than it should. So if people are using their medication properly, if they're following prescriptions, if they're seeing their doctor regularly and having their medication updated or the dose adjusted if it needs to be, that sort of thing, that's really important. And it's very important as well, especially when it comes to children, that inhaler technique is used properly as well. So there for children, oftentimes it's difficult to ensure that they're using an inhaler properly, especially younger children. There are devices that are available, such as spacers, that can help with that to make sure that as much of the medication as possible is getting into the lungs where it needs to be. So this is something, again, that needs to be part of the asthma action plan that every child, every patient for that matter with asthma should have, and monitored on a regular basis. And oftentimes, as I said, during the summer, we see people out of routines. They're on vacation, they're away at camp and so forth. And sometimes those medication routines take a bit of a hit in terms of being followed as they normally would be. It's really important to stay on top of that.